Today we're going to be talking about constipation and how we want to deal with that naturally. Hi, I'm Dr. Mona Morstein. Welcome to my channel. If you're not a subscriber, please click on the link below and let's get started. So constipation is a really chronic problem in the United States. Generally, in most adults, 16 out of every 100 have it chronically. But if you're over 60, get this, 33% of people have constipation. 1 out of every 3. Now, conventional medicine guidelines for pooping are kind of ridiculous. If you read the Merck manual or go to Mayo, they're going to say, well, it could be normal to have 3 bowel movements a day or 3 bowel movements a week. I mean, that's idiocy. Who creates these stupid guidelines, right? Everyone should have a good bowel movement every day. That's your decent Bristol force sausage, makes you feel completely evacuated. That's what people should have every day. Now, you don't have to poop after every single meal. That you don't need that, but at least 1 good poop a day. If you have a second, that's great. Now, when do we have constipation? Well, you have constipation if you have daily bowel movements, but they're small, they're little rabbit pellets, they're hard, you don't feel that you completed your bowel movement, just a few come out, you may need to strain. I mean, you can go several times a day, but if you're just pooping out little bits of poop, that's constipation, right? You can also have constipation by just skipping days, either with or even without an urge to have a bowel movement. And other symptoms that come with constipation is feeling bloated and full and heavy, weighted in your abdomen, maybe getting some bad breath because you're not detoxifying all of what should be coming out, right? And then also needing help to have a bowel movement. So you have constipation. What's the big deal? You poop when you poop. Well, you know what? There are several negative problems with having constipation. One is you are reducing your ability to detox. So the liver to the colon, this is a big part of detoxification, as well as the kidney, the skin, and the breath. This liver to poop, that is a big part of our detoxification. And if that's not happening, then yeah, you're not going to be getting rid of environmental toxins or mycotoxins or heavy metals or things that your body is just like, I don't want this anymore, or cholesterol or other things. You could also get, of course, hemorrhoids from constipation and anal fissures from constipation. You can start developing diverticulosis, which are outpouchings of the colonic wall that can lead to diverticulitis, a painful infection in those outpouches. You can get a fecal impaction, bowel obstruction. In kids with constipation, they oftentimes get what's called encopresis, which is stool just stuck there, but then it kind of other liquid stool goes around it, and then there's fecal incontinence, like a liquidy fecal incontinence that can happen with adults as well. And the last, you can even get a rectal prolapse from chronic kind of constipation. People don't have a good quality of life, and there are some serious connections to it. What causes this kind of chronic constipation? Well, certainly not getting enough fiber in. Now, Americans tend to eat around 10 or 12 grams of fiber a day. They should eat 30, 35 grams, right? And we'll talk about fiber in just a second in terms of treatment, but that low fiber is going to definitely negative impact stool formation and movement. Also not getting fluid in, right? There's a lot of dehydration that causes constipation. Maybe not having good digestive enzymes is going to prevent the movement through of the gut. Getting not enough Exercise, right? Not moving can do that. There are people at certain jobs or schools, or just they're embarrassed, that hold their poop when they should let it go. People don't feel comfortable having a bowel movement in a public restroom or at work or so forth. And that can cause problems over time. We can get a microbiome dysbiosis. For example, sebomethane can cause constipation. Fungal overgrowth can cause constipation. Low beneficial bacteria can cause constipation. There are other things that can reduce motility, such as scar tissue and certain medications like opioids, for example. Other medical conditions can affect movement through, like if you have a diabetic neuropathy or hypothyroidism that isn't well treated, or you're pregnant, or you have multiple sclerosis. These can affect the motility through the gut. And then also food sensitivities can be, as my grandmother called, binding and not allow good bowel movements. So for standard medications, if you complain to your conventional doc about constipation, of course, we're going to start with laxatives. And then there are what we call cathartic or stimulant. And these are pretty rough, right? Your senna, rhubarb, cascara, black walnut. These push and cramp the colonic cells and muscles to really have a strong peristalsis. You just want to be home when the blowout occurs, okay? There's also lubricant, which we don't use too much anymore. Lubricant laxatives are like using mineral oil. We tend to more use osmotic. So osmotic kind of brings water into the gut, so it makes it easier to pass. And this is your Miralax. This is your milk of magnesia, or just taking a lot of magnesia as a supplement is a laxative. Products like that. There's also then stool softeners. Not quite a laxative because they're as addictive to the system, but they also bring water in, and this is like Ducasate. Lactulose is also considered. And then, of course, typical MD might say use some fiber. They have drugs called prokinetics like Amitiza, Linzess, Motegrity. If it really gets, this is what we would call chronic idiopathic constipation, which is you are not going a week, 10 days, long term without help. And so for those, they'll give these drugs as prokinetics to move the gut forward. And then there are other laxatives used specifically for people on chronic opioids, right? Well, how does a naturopathic physician deal with chronic constipation? Well, first I'm going to do a diet diary, right? I want to see, what do you eat and drink? What's good? What's not? How much is whole food? How much is fast food? How much is junk food? How much is sugar, which is constipating? So we have to just take a look at the diet as a whole. Sometimes with kids, you see they're not eating any fruit, and a piece of fruit a day alone can help a child have a bowel movement, right? So definitely looking at the diet and then working with patients to tidy it up and make it healthier, more whole foods, more whole grains, more fruits and veggies is very helpful. I might do a food sensitivity test with a patient to see, is there some food they might be eating? I might do a stool analysis. Do they have a fungal overgrowth? Do they not have enough beneficial bacteria? Maybe we'll do a SIBO breath test. Do they have that? Do they have a methane SIBO going on? These are all treatable and curable, so it's good to know that those could be etiological factors. Then making sure there's exercise. Also, mental, emotional stresses, right? We have to work on that level, mind, body. Are people under stress or feeling imbalances that could be affecting how their bowels are working, right? Even things like, how do you eat? Are you a fast eater that wolfs it down in 5 minutes that you're sitting at a red light in your car? Or do you create a calm, cool environment and you're chewing and relaxing and helping your food get digested easier? We're going to look at the diet. We're going to really tidy that up. We're going to treat what we need to drink. We're going to remove food sensitivities if you have them. Fluid. Here's the deal. You have no idea how many patients are better when they just wake up in the morning and drink a liter of water, ideally with a little lemon in it, because the lemon will stimulate your liver to produce bile, which signals your colon empty out, right? But say you sleep for 7 or 8 hours. Well, you weren't drinking then. You probably didn't drink a couple of hours before bedtime, knowing you'd have to wake to pee during bedtime, during sleep. And then you get up and maybe it's another half hour or hour before you're getting going. Like, you could not be putting fluid in your body for 10 or 11 hours. Try doing that during the day. You'd be dying of thirst. So when we wake up, we put that liter of water in us. All of this water hits and lubricates and moves the colon, and it's an amazing benefit for having that early morning bowel movement, right? And that is, again, then you want to drink half your body weight in ounces the rest of the day, minus, of course, the liter you just drank. Then we want fiber. So we want at least 3 cups of veggies a day, 1 or 2 fruits, whole grains, and beans. There's nothing food-wise that has more fiber than beans. A cup of beans can have 19 grams of fiber. That's a lot. That's great, right? Now, there are 2 kinds of fiber: soluble, which brings kind of water into the stool, like psyllium, and insoluble, which bulk the stool and make it easier to pass, like wheat bran and oat bran. Now, if you're doing keto, I don't want to eat whole grains and beans, guess what? You can still have veggies. Avocados have a lot of fiber. There's this amazing bread called carbonate keto gluten-free bread. 1 slice of it is only 40 calories and 15 grams of fiber. It's crazy. There's also this keto gummy called Kiss My Keto Fish Friends. A bag of it is 80 calories and it's 31 grams of fiber. You don't have to eat the whole bag, but I mean, there's pretty great ways that anybody can get a lot of fiber now in their gut. On top of that, we might want to do an Indian herb called triphala, which is a really great gastrointestinal toner, like adaptogen. Just helps loads of things work better in the gut. We're also thinking about bitters, gentian, orange peel, ginger, artichoke, dandelion, burdock, fennel. These are bitters, help with digestion and move the gut along. Really great to take so you can taste it in your mouth and do that bitter shake that is going to stimulate everything. We also might want to do some digestive enzymes, certainly help with the exercise and stress management. When we pull all of these together, it's really, really common that most patients are really getting into better bowel experiences every day. Do some people still need to be on the medications like Amitiza or Motegrity? Yeah, some do with that really chronic idiopathic constipation. But many, many, many patients, when we do this whole protocol, it's really going to straighten them out inside. And then they and you can just have that amazing relief of that really good bowel movement every single day. So I hope this has been helpful. I'm Dr. Mona Morstein. Remember to subscribe to my channel. And if you want to schedule a patient visit with me, click on the bio below and it'll take you right there. Thank you very much.